My name's Leticia Dirks. I'm a pediatrician with Pediatric and Adolescent Associates, a part of Lexington Clinic. And today we're going to talk about infant sleep. I hear a lot of concerns from families about sleep in those first few months with a newborn, which is understandable because it's a big adjustment period for families. When you bring your newborn home, a lot of the time they're spending most of their day sleeping. So their wake windows are actually pretty short in those first few months. They can be anywhere from like 30 to 90 minutes in length. But what that means is that they're spending a lot of their time awake with eating and then doing a lot of sleeping otherwise. So as long as your baby is waking up to eat regularly and at least every 3 hours, those are the things we're typically looking for to know that they are, doing what is expected of them and getting good nutrition. I get lots of questions from parents about babies having an altered sleep schedule when they first come home from the hospital, meaning they often are very awake and excited and ready to interact with parents in the middle of the night, but end up spending most of their time during the daytime asleep and hard to get that same level of interaction. This is a really normal thing that we see with babies, partially because they are still developing their normal kind of sleep pattern that we have as adults, and it typically does get better with time. Parents often ask me what they can do to help fix that day and night sleep confusion. During the daytime, keep the overhead lights on in your house, keep the curtains open, make it a bright and welcoming environment that signals to your baby that, it's daytime and we want to be more awake and alert during this time frame. They're still going to sleep a lot of the day early on, but having those visual kind of reminders between the difference with day and night really helps. At nighttime, it's also important to make sure the environment's set up for success. So make sure if and when you're up feeding the baby in the middle of the night that you keep it pretty dark in the room. If you need a little night light or soft light to help see, that's totally fine, but want to refrain from turning on big lamps or overhead lights. We also want to make sure it's a calm and quiet environment at nighttime. Sometimes things like sound machines can help with that. And also having a nighttime routine that the baby can learn to recognize as they're getting older. That can include things like using the swaddle for sleep at nighttime, having a little bit of a bedtime routine where we maybe rock to take our bottle or rock before taking our bottle before bed, or take a calming bath time routine as well. As they get older and get used to those patterns, it gets easier to establish more of that day and night differentiation, but it does take time. While we're talking about sleep, I think it's important to mention that newborns will do lots of things that are adorable, but can also scare their parents. Babies actually have shorter sleep cycles than we do as adults, and they end up spending more of their time in REM sleep, which is that more active sleep. So with that, you might notice that while your baby's sleeping, they do lots of silly things with their face, like squinting their eyes or twitching their eyes, looking like they're blinking. Sometimes those worry parents that they're signs of seizure behaviors or other concerns, but often they're just normal sleep movements. Babies also will sometimes do what's called periodic breathing, both while they're sleeping and while they're awake. They will have short breathing pauses that are usually less than 15 to 20 seconds. And to make up for that pause in breathing, they'll turn around and breathe really rapidly for a few seconds. This can sometimes scare parents or worry them that it's a sign of a respiratory problem. But as long as those breathing pauses are short and they go back to a normal breathing pattern, it's typically not anything to worry about. I think it's important to remember that, in the first couple of weeks of a baby's life, we want to make sure that they are waking up to eat every 3 hours during the nighttime as well as the daytime. Your pediatrician can help guide you on when it's okay to let them sleep longer stretches, but often we want to see them get back to their birth weight, which is usually around 2 weeks of age. We want to make sure we're always practicing safe sleep for babies. And what that means is that a baby is always sleeping in their own bed, whether that's a bassinet or a crib or a playpen, that they're being put to sleep on their back. They can be swaddled in a, tight blanket that provides comfort, but shouldn't have any extra thick or fuzzy or warm and soft blankets in the crib with them. We also want to avoid things like crib bumpers, as they can make it an unsafe sleep environment. For more information regarding your baby's sleep behaviors or guidance on how to promote a safe and healthy sleep environment, reach out to your board-certified pediatricians at Pediatric and Adolescent Associates. You can reach our number at 859-277-6102.